it. So
Hi Vasu, you're in the clinic.
Now we are live. So I am starting the program. Oh. Today in the media conference with Lal Goel, which is brought to you by V4 News, Karu News, V4 Stream, Malnadu TV India, News Gaon Se, Samvad Sarokar News, Bharat Post News, Gyan and Organ Donation India Foundation. Our endeavor is to enlighten you with the current topic. And today's topic is not only current, but very, very relevant. And as you all might be knowing that today the world is observing World Kidney Day. World Kidney Day, WKD, is a global health awareness campaign focusing on the importance of the kidneys and reducing the frequency and impact of kidney disease and its associated health problems worldwide. World Kidney Day is observed annually on the second Thursday in March. This year, the day is being observed on March 10th, that is today. The main aim of the day is to raise awareness among people about the increasing number of kidney-related diseases across the world. The day also emphasizes the need for different strategies in order to prevent kidney diseases. Back in 2006, World Kidney Day was celebrated for the first time. The day also encourages people to go for regular screening in order for them to make changes for a healthy lifestyle. In India, every year about 2 lakh people suffer from kidney-related disease, and the worst part is that the disease is difficult to diagnose in its initial stage. The kidneys are one of the most vital organs in the human body. The main function of the kidney is to filter the blood and help in passing waste through urine. The Joint Committee of the International Society of Nephrology and the International Federation of Kidney Foundations first started the celebrations of World Kidney Day. The theme of World Kidney Day 2022 is set as Kidney Health for All. The number of Indians suffering from chronic kidney ailments has doubled in the past 15 years, and at present 17 in every 100 citizens suffer from some form of kidney disease, health experts have said. Studies estimated that some 150 to 230 persons suffer from end-stage kidney diseases, ESKD, in every million people, and about 220,000 to 275,000 new patients need renal replacement therapy, RRT, every year. The exact burden of chronic kidney diseases in India is still undefined, but its approximate prevalence is said to be 800 per million people, PMP. Change in lifestyle is the major cause of the rising kidney diseases. Lesser fluid intake, smoking, excess intake of medicines and drugs, and salt intake are the reasons contributing to the rising chronic kidney diseases. There are 700 dialysis centers with a total of 4,000 dialysis machines, predominantly in the private sector and mainly concentrated in cities, especially metros. There are around 20,000 patients undergoing dialysis at these centers. Only 4% of the patients get a donor. And to discuss this very, very important topic, World Kidney Day, we have a very elite, knowledgeable, those who are expert in this field, panelists are with us. I would like to invite my first panelist guest, and he's Professor Dr. S. Vasudevan. Professor Dr. S. Vasudevan is the chairman of Indian Medical Association, IMA, Standing Committee for Organ Donation. He is the professor and head of the Department Urology, Government Medical College, Thiruvananthapuram. He is a member of Kidney Transplantation Subspecialty Cell of the Urological Society of India. He started his urology career at Government Medical College, Calicut, and has spent over 30 years in the specialty. His concern for the renal failure patients and the difficulty faced by the family in arranging a donor in time led to efforts at organ donation awareness campaigns. IMA provided a perfect platform and many opportunities opened up. He became the chairman of the Organ Donation Awareness Committee in Kerala State Branch of IMA. Later, the IMA National Headquarters provided the IMA Standing Committee for Organ Donation. He has been awarded the Inspiring Urologist Award by Economic Times Group on the occasion of Doctors' Day 2021 for his contributions in kidney transplantation. Recently, he was included in a coffee table book brought out by the Times of India Group. Welcome, Professor Dr. S. Vasudevan on our show. Professor Dr. S. Vasudevan, today world is celebrating World Kidney Day. Whether we are going to use the word celebrate or not, that is a matter of discussion, because it's a very pathetic condition, especially in India. Now, you being such a senior urologist, and you are connected with the All India IMA, Indian Medical Association, as a standing committee for organ donation. You are the chairman. So we would like to know your views on World Kidney Day. Professor Dr. S. Vasudevan, please.
Thank you, Lal Goel sir, for this opportunity. This has been really, I would agree with you that the word celebration should be substituted by observing. We are observing actually this day. And you have told us already what is the reason why this day is being observed. We have a very tough problem in our hands. We have to cater to the large number of people who really are going without proper treatment and without a proper organ transplantation in time. In many of the large states, we know that all patients with kidney failure don't even really have an access to a center with a nephrologist to get it get into dialysis programs immediately and also into renal transplantation programs at the right time. So that is a big challenge which we have to, and many states are now giving more importance to this program so that they are getting, they are able to cater to more and more patients, because many governments are taking up this program of instituting dialysis in the smaller centers. Like in Kerala, we have more centers, as you said rightly. There is a higher percentage of these centers in private sector. But in the last few years, we see more and more district centers as well as taluk centers being equipped with dialysis centers so that we are able to take up more patients. We have been training more physicians to take interest in this so that even if a nephrologist nurse is not available, they are able to do the work with adequate trained personnel. And the next challenge is to see that all patients who need a transplant are able to get that in time. For that, we need to create an infrastructure whereby we need to have more centers capable of doing transplants regularly. So we have already discussed in this many fora, and the need of the hour is to equip more centers to do. We have to handhold more centers to be able to do transplants, and for that we need to create these facilities also in district centers, and we need to ensure that all medical colleges are equipped with these centers, with these transplant centers. So we need to handhold them and see that the proper facilities are created. And the third priority is to ensure that even when adequate live donors are not available, we need to have increase the rate of disease donor donation. I'm sure Dr. Sunil Shroff will be telling us more about what are the initiatives, because all the professional bodies like IMA, like Urology Society, as well as Indian Society of Organ Transplantation, they need to work together and bring up a program which the government should be able to implement. I'm sure we would like to hear what Dr. Sunil Shroff has to say in this matter. Thank you.
Thank you, Professor Dr. S. Vasudevan. I will come back to you after first round. And I was Professor Dr. S. Vasudevan also said that the unfortunate part is that still we are lacking lots of infrastructure facilities, especially in the government sector. Although private sectors have dialysis centers, but the transplant centers are lacking. So until we will not have all those centers, it's very difficult to serve the entire population because the disease is such. But he says that lots of work is started, and the government is also taking initiatives, and many organizations are also doing, including the IMA, and etc. So he says that he's hopeful that we will be able to get more and more centers for not only for dialysis but for the transplant also. Thank you very much, Professor Dr. S. Vasudevan, for giving your views. Now I would like to invite my next panelist guest, and he's Professor Dr. Sunil Shroff. Professor Dr. Sunil Shroff is MS FRC. He is the managing trustee of Mohan Foundation. He is the senior consultant of urology and renal transplantation at Madras Medical Mission Hospital, Chennai. He is well known for his work in the field of disease donation transplantation in India. He has worked towards improving the diseased organ donation rate in India. He did his undergraduate and postgraduate medical education from Prince of Wales Medical College, now called Patna Medical College and Hospital, in 1982. He did FRCS in 1986 from Royal College of Physicians and Surgeons of Glasgow. He joined as a lecturer first at the Institute of Urology and then at the Royal London Hospital in London from 1991 to 95. In 1995, he became professor and head of the Department of Urology and Renal Transplantation at the Sri Ramchandra Medical College and Research Institute, SRMC and RI. Currently, he is senior consultant urology and renal transplantation at Madras Medical Mission Hospital in Chennai. He started the kidney transplantation program at SRMC in 1995 and in 1996 implemented the disease donation transplantation program. SRMC and RI was one of the first few hospitals in India to have established such a program. He performed the first kidney transplant on an HIV positive patient in India and transplant of kidneys from cobra-bitten brain-dead victims. As a founder trustee of Mohan Foundation, he has been actively promoting the concept of disease donation after brain death since 1997. Dr. Shroff is president of Indian Society of Organ Transplantation. He has over 40 publications in peer-reviewed journals, has edited 4 books for paramedical staff, and has written 6 chapters in medical books. He is visiting professor of All India Institute of Medical Science, Rishikesh, Uttarakhand, India. He is president of Tamil Nadu Telemedicine Society of India. Welcome, Dr. Sunil Shroff, on our show. Professor Shroff, you have heard what Professor Vasudevan has mentioned. And he says that although IMA and other organizations are doing, but still it's miles to go. So we would like to know, because you are not only a senior consultant and a doctor of urology, renal transplant expert, but also you are associated with one of the leading most, I must say the leading most of the NGO of organ transplant in India, that is Mohan Foundation. So definitely we would like to know your views about the World Kidney Day. Professor Dr. Sunil Shroff, please.
Thank you, Goel ji, and it's always a pleasure to be on your forum. And truly amazing work you yourself are doing in promoting the concept of organ donation. You've been helping us for the last few years in this endeavor, and please keep doing this good work. As regards the World Kidney Day, first of all, I would like to tell the listeners that your kidneys are truly amazing. I just want to say that everyone has born usually with 2 kidneys, sometimes with 1 kidney. Remember that. And one needs to take care of the kidneys, because between the brain, which has neurons, and the kidneys, which have nephrons, the nephrons actually, to be honest, are more complex perhaps than even the neurons. I say this for a reason. The brain receives every minute about 600 to 700 ml of blood. The kidneys receive close to 1.2 to 1.5 liters of blood, which is 25% of your heart output every minute, 25%. So the brain actually receives a little less blood supply than even the kidneys, because the kidneys are your body's chemist in a way. Because if you want to remember the function of the kidney, it's very simple to remember. I always say remember the A, B, C, D, E for kidneys for remembering the function. A is for acids. It clears all your acids from your body. B is for blood pressure control. It controls your blood pressure every second. C is for clearing the other toxins besides acid. Acid is a toxin in your body, because what you eat and all produces acid, and that acid needs to be removed somehow. Otherwise, if the cells will get sick in your body. So it clears other toxins like urea, ammonia, uric acid, creatinine, drugs which you sometimes consume. Then there is some D. D is for vitamin D. Vitamin D is very important for your bones. So kidneys keep your bone healthy. Although the vitamin D is produced by the sun, if you sit in the sun, the vitamin D is produced. But to make the vitamin D active, you need your kidneys. So again, that's the important function of the kidney. And E is for excess water. Every day the kidney clears about 1,500 liters of water, goes through, is produced by the kidney, of which only 1 to 2 liters is excreted out. So kidney, it removes your excess water. It filters your excess water. So that's again very important function. And again, E is again important because erythropoietin is a substance which is produced by the kidney to produce your red blood cells, which carries your hemoglobin, which takes care of oxygen and carbon dioxide. So the A, B, C, D, E of the kidney is very important. Acid, blood pressure, clears toxins, vitamin D, excess water, and erythropoietin. Remember that for your function of the kidney. At least these 5 functions, if you remember, you'll know why your kidneys are so important to you. I'm not saying other organs are not important, but among all the organs, there are 3 organs which are extremely important to you, 3 or 4 organs. One is your heart, your lungs, your liver, your kidneys. These are vital organs. You need to have these organs to keep yourself totally functional. And among all that, kidney is one of the most complex organs. So take care of your kidneys. Get regular checkups of your kidney, because the gap between demand and supply of the kidney, on one side you have kidney failure, which is increasing. In about 20 years, kidney failure will become the 5th most common cause of death in the world. The only way is to prevent kidney failure. And the only way of prevention of kidney failure is for early identification of disease. Today, we have an increasing number of lifestyle diseases, be it diabetes or hypertension, blood pressure. And diabetes and hypertension are responsible for 50% of the kidney disease. Remember that. So we have to we have to talk about prevention all the time. And if we don't do prevention and early identification of kidney disease, we will never be able to bridge this gap between the demand and supply, whatever we do. How much ever we work on this program, how many ever more kidneys we produce, this gap is only going to widen in the world. Because even today, every 10th person has some problem with the kidney. If you do a complete test of the body, even today, every 10th person will discover something is happening in the kidney. So early detection and prevention is the key. And today on the World Kidney Day, just go out there, get a small checkup, as simple as checking your blood pressure, as simple as getting a urine test to look for protein. If you do these 2 tests, you'll know that there's something happening in you, because kidney disease is a silent disease. Only when it is advanced do you get to know that there's a kidney failure. So today on the World Kidney Day, while we celebrate, the world is celebrating, but it's very, very important out there for all the citizens to remember that you must go for routine checkups. Even if you're young, doesn't matter. Simple tests, blood pressure and urine test, will detect most of the kidney disease early. And then you can take preventive action. So one side, I would like to very much stress on the prevention of kidney disease to take care of the global needs of kidneys. Because as I said, this will always be an unmet need, Goel Saab. Whatever we do, how much ever we publicize, will always be, in some kind of a problem. Having said that, how do we take care of the demand of the rising kidney failure? I've given you the bleak scenario, where 1 in 10, and I've said in 20 years' time, kidney disease is going to be the 5th most common cause of death in the world. So how do we take care of the demand? So to take care of the demand, obviously we need to increase the donation rate. We can increase the donation rate for living donation. Today, the government of India has a law on transplantation. It allows for, besides, your relatives donating, it also allows for, swap donations, where, if you don't have a compatible blood donor, you can swap it with somebody else. At the moment, it's only between first relatives, but we are hoping that soon the government will come out where it will relax this swap, because swaps are happening more and more commonly. In US, 20% of the demand of organs are being taken care by swap transplant. 10 to 20% are being taken care of swap transplant. So in the living donation, one opportunity is because we have small families today, we may not have a compatible donor within the family. And so if there's a similar situation with another family where you don't have a donor, then one family can swap the organ with another family without any commercial requirements, as such. So if let's say somebody has got A blood group and needs a kidney, but the donor is B who's willing to give, and another family there's a B who requires a kidney, and A is the donor, so they can swap. So there's simple mechanisms by which we can take care of some of the demand of the kidney. So this one is swap donation. The other is an ABO incompatible. Today we're also doing ABO incompatible transplant. This is more expensive though. It costs almost double the normal cost of kidney transplant. It is slightly riskier, but we are getting better and better at it. In the last 10, 15 years, there have been good advancements towards ABO incompatible transplants. So that's another option which can take care of some demands of the kidney for the living situation. And of course, your first relative, including the grandparents and grandchildren, can donate today. Besides your brother, sister, father, mother, wife, husband, son, daughter, your grandparents also can donate, and your grandchildren. So that's the pool of relatives who can donate. If there are no relatives, then you can go for altruistic donation where maybe a cousin or a friend is willing to give, but there should be no commercial motive in the donation. So these are the possibilities of living donation. As far as disease donation is concerned, there is a huge opportunity to increase disease donation in our country. In our country, unfortunately, there's a huge number of road traffic accidents which happens in our country. Every minute there's a death on the road in our country. It is estimated that 160,000 road traffic accidents happen every year in our country, 160,000. Most of these deaths are young people. And in these deaths, almost 60 to 70% of these deaths are due to head injury, head trauma, which means close to about 90,000 have a head injury as cause of death. And in that 90,000, many will be having brain death. So at the moment, we are not even taking 1% of those donors with us. We are not even going to about 900,000 donors of the 90,000 perhaps brain deaths in our country. So there's a huge opportunity. And these are young donors, which means that the organs from these donors will work. Because this is, having a death of a young person is a hugely tragic event. The only positive outcome of this tragedy is going to be organ donation. And for that, we need hospitals to be geared up, the hospitals to have the infrastructure. The hospitals should have trained counselors, trained transplant coordinators. That is required. So if we don't have a trained person to talk to relatives, the relatives will always say no to donation. Many of those no's will remain no. But if you have a trained counselor, many of those no's will become yes to donation. We have trained close to about 3,000 coordinators today as Mohan Foundation. And that's the conversion rate we have on the hospitals. Wherever we have trained counselors, 70% yes to donation they get. From no to yes it comes, So what I'm trying to say is we need to improve the infrastructure of the hospital. I say that we create, there's a little hype when an organ is transported from one city to another city or one place to another place, we create what is called green corridors on the road where the organ moves very smoothly in the traffic, uninterrupted. What we require is green corridors within the hospital today, because there's a lot of problems in the hospital when a donation happens. There are a lot of, resistance sometimes from the doctors, sometimes from somewhere else. So we need to create these green corridors. We need to put processes in place within the hospital. I think Prashant is here, who is my colleague. Vasudevan is here, who is my colleague. They'll both concur with me that today the problem is not in the public domain. Public will say yes to donation. The problem today is in the hospital domain. Many hospitals are not geared up, and then they blame the public. So doctors have to introspect and say, where is the problem in the hospital? Today, when we're doing 900 donations, believe me, that this is only, of the 2,000 families we say to yes to donation, only 900 happens in our country, or 800 happens. Even in that, we could have been doing 2,000. The rest 1,200, 1,500 don't happen because the donor crashes after the family has said yes to donation. So immediately the number can double or triple, even without doing anything, if we only maintain our donors properly. And imagine if we unleash the hospital's infrastructure towards donation, have trained counselors, what can happen? In the country today, we have 540 medical colleges. I give this example always. 540 medical colleges in the country today. The government of India wants to have a medical college in all the 738 districts of the country. What I'm trying to say is all the medical colleges are geared up. They have good infrastructure to at least do donations, if not transplantation. So I, appeal to the government of India that make all your medical colleges organ donation centers as a first step, and tell them that within a year after you start doing organ retrieval from brain dead donors, you should start doing transplants. So immediately your infrastructure will improve. Of the 260 medical colleges which you have today in the country, which are for the government medical colleges, only about 10 do transplant, believe me. 250 medical colleges don't do transplants, although they have the infrastructure, they have the staff. So there are simple things which we can do without even costing money, which will increase our transplants. Because today, most of the transplants are happening in private sector. Okay, most of the deaths, although the donors are coming from the private sector, but most of these deaths of brain deaths are in the government sector. So unfortunately today, the large majority of donors are in the government sector, which are never utilized. They are never given a chance to donate. Whoever donates in the private sector, maybe 800, 900, these are the donations we are looking at more and more. But we're not looking at the large number of brain deaths which are actually in the government sector. So what is happening is a person who can afford can get a transplant. The patient who can't afford can't get a transplant. So there's the equity in transplant is missing, because transplant should be available for everyone. That's the theme of the World Kidney Day as well. Kidney health for all. So we need to look at equity. We need to make sure that the poor also get a transplant, and that can really happen in the government sector. It can happen in the 260 medical colleges of the government. So my appeal to the government of India is start making empower these government colleges, make them, start retrieving organs, improve their infrastructure a little bit. Then you can make them transplant centers, start doing kidney transplants in the government sector, so that there's an equity kind of, is distributed. Today, government gives private sector 5 lakhs, 10 lakhs for a transplant. Why should they do that? Instead of that, improve your own infrastructure and start doing it in your own government sector. Save that money, invest it in your government sector hospitals, so that the poor also can get the transplant. So everybody can get a transplant. So then the trust will build up in this program, and then you stop having the scandals in the program. So we need to do multiple things at multiple levels, Goel sir. If we do that, I think we'll be a winner. And that's what is required. Thank you very much.
Okay, thank you very much, Professor Dr. Sunil Shroff, for giving your views. And Professor Shroff has very clearly stated that the reasons, he has given all the reasons, he has explained about the diseases, about the kidney disease, and he has also mentioned that if we will not take timely action, this disease is going to be very, very deadly. Already it is deadly, but it is going to increase more. And he said that the government should be proactive now, try to empower their own medical colleges, because he has given a very startling figure that he says out of 260 government medical colleges, only 10 are doing transplantation, which is very, very such a, I must say, poor condition. It shows that how come a medical college or government medical, but it is fact. I know in Uttar Pradesh, the medical colleges of Agra or Aligarh or many other, they are not even doing transplantation, even about the organ donation also. There is no facility like that. So because you have to go, I know that you have to go. So I would like to ask you one thing. Don't you think forget about the infrastructure? The problem today in India is, because the other day I was addressing the CISF people in Mangalore, and they raised very pertinent question. They says, we want to donate. Somebody was declared brain death. We wanted to donate, but there was nowhere we have to know to whom we should contact. We have asked the government hospital doctor. They have not taken any interest, and we were in alert. And they says there is not a single contact thing. So do you think, Dr. Shroff, that there should be one common national number of 3 or 4 digits where a person can dial, will get all the information where to go for the nearest place and get this thing done? Otherwise, as you rightly said, that many people wants to donate, but there is no way to donate. And even if they are aware, the time is, and this time is very crucial in this for the donation. What do you say about this, Dr. Shroff?
I think it's a very relevant point, and we keep having this many times. This question keeps being asked. Well, sir, but the thing is, this only will help with people like you for creating awareness in the media, to the media. Times of India has done a lot of awareness. You are doing awareness. NDTV has done a lot of awareness. I think that is very much required because we need to educate the public and the doctors. What actually donation means. You need, if you want to donate, a few things you need to do. You need to speak to your, you need to have this conversation with your family first of all. The other day I had a call from a doctor. In fact, I got a WhatsApp message. He's a doctor. He's a colonel in the army. He's an intensive care doctor. And he said, Dr. Shroff, I didn't even know my father is carrying a donor card of your foundation. He died. This was last week. And he sent me his donor card picture. He said, I didn't even know he was carrying a donor card. So carrying a donor card is not enough because at the time of death, if somebody needs to, take your wishes forward. So the first thing you should do is, if you want to be an organ donor, you need to speak to your relatives, next of kin, and you need to express your desire to donation. So, what we have done in our foundation, we encountered this many times. So we have come out with the concept of family donor card, where the whole family kind of, pledges organs. Then there's no confusion in the family. Whereas only if one person, pledges and, doesn't say, to the next of kin, then nobody will know. So I know that your question is a little different, but I just wanted to stress this point this is a very important point, because many times even the family members don't know that their loved one is donating. So this having a conversation with your family is very important. बातें करना बहुत जरूरी है कि आप बात करिए, आप बोलिए अपने family को कि I am an organ donor. This is very, very important. As regarding having a helpline, a single helpline, Noto has a helpline number, I must say. At our foundation, we have a helpline. We every day take about 25 calls to 30 calls every day in 8 languages in our foundation. The number is available very easily. All you have to do is donate organs. I think even Organ India has a helpline number. They take because see, India is a huge country, 1.4 billion people, and we will need multiple helplines. Just having 1 or 2 helplines is not going to be useful because the information should be available anytime. If somebody says, I want to donate organs, some helpline number should flash on, some search. So it could be either Noto, it could be Sunaina's, Organ India, Mohan Foundation, doesn't matter. As long as the information is reached. But I can tell you, Goel Saab, the helplines are helping to a great extent. We only started the helpline with an idea of only helping with information on organ donation. But on the helpline today, we are also doing, eye donation, body donation, organ donation also. In fact, we've had calls from relatives, just like you said, we don't know what to do, but we have had calls in the middle of the night where they say that my loved one is brain dead. Doctor is saying brain dead, and we don't know what to do. And then we have gone back and informed that hospital, look, there's such and such ward, such and such a person is possibly brain dead. Why don't you go and check out? And in many instances, in a few cases in Bombay, it has turned out that actually the person was brain dead and the donation happened. In fact, so much so that 3 or 4 years back, we had a call from Dubai that, somebody is, brain dead, my relative is brain dead. The hospital is saying, he's brain dead. We don't know what to do. What can we do? And then we counseled the, brother of that donor for 1 hour on the phone saying that you can donate organs. Then we contacted Dubai Health Authority and told them there is like this available. And that donation happened. So I can tell you the helpline really helps. So what you should do is, one thing which you can pass on in your message, you do so many conferences, you can have for organ donation, you can flash some helplines on one of your corners, just like you have media conference with Goel. You can also flash some organ donation helpline numbers, be it of Organ India, be of Mohan Foundation, or be of Noto. You can flash some of these numbers on your platform, and that way we will be able to inform people, because at the time of grief, nobody knows what to do. Everybody is in going here and there, but getting to a telephone number is very important. At least somebody can guide you, because death can happen anywhere. It may not happen in Bombay. It may not happen in in Delhi. It may happen in a remote location where there are no also hospitals as such. We've had deaths which are happening in remote locations. There was a death which happened near Salem, and they wanted to donate. We told them that, look, in your place, there nothing can happen. Take an ambulance, take the body to Salem, and this hospital you go, your donation will happen. So we have had those calls also. So I think that the solution here is having a helpline number in that situation. And speaking to your relatives about donation, especially if you're in a big city, you must tell your relatives you want to be an organ donor.
Okay, thank you very much, Professor Dr. Sunil Shah, for giving your views. And you rightly mentioned about the highlighting the numbers. But the unfortunate part in India is that if we ask, forget about my media conference or one or two channels who are doing, but if you go for any of the publication or for the media houses, they want money even for this. I approached the airport authority here in Mangalore, and I said, you are having so many hoardings, at least one hoarding you can put for the organ donation, where you put some message. So many passengers are coming, at least they can watch, and it is not going to profit me or to anyone. We do not want any name, we want the awareness to be created. But as you know, the bureaucracy is such, they can't understand until unless they have their own problems, then only they will understand.
Absolutely.
Otherwise,
We
yes,
also tried, Goel sir. We also
yes.
tried with media. We not had much like I'm sure Smena also tried. But we in our own way we are trying to do our best. And but to be honest, today is much easier than before. And these are all toll-free helpline numbers. It doesn't cost you any money.
No, that's
In fact,
true, but
you just have to dial. It doesn't cost you any money. So these are toll-free helpline numbers.
no, but true, but Dr. Shroff, to keep people aware about this number, you require advertisement, you require publicity.
But
That
the
is
thing
the
is,
main point.
today the good thing is Google is very clever. So you say want donate organs, want or something like that, and their helpline numbers will flash right at the top, right at the top.
Okay.
Right.
Thank you very much, Professor Dr. Sunil Shroff, for giving your views.
Thank you, sir.
I hope that next year we will have some advantages of less number of patients. Let's hope the better sense will prevail to everyone, to the public as well as to the
I also
government.
wanted to tell one more thing, Goel sir, before I go.
Yeah.
If I'm able to share my screen, we have just launched, on this today, not today, in the last.
See, now problem is only one, Professor Shroff, because it's a live telecast,
Yes.
and we have to make the earlier arrangement with for the sharing.
No,
If you will
problem.
share, so it will
all
not
I'm
be.
trying to all I'm trying to say is we have a course for the public out there on how to take care of kidneys. So if they want to do a course, a 2-hour course, online course is available on how to take care and protect your kidneys. So on this World Kidney Day, I felt that it is very important for people to know. Well, that besides, of course, wanting to create awareness about organ donation, I think the key here is prevention of kidney disease. And for that, I think everybody should go through some kind of a reading material, some kind of authenticated reading material. So we do have a course. You can log on to our website and you can see the course is there somewhere. It's it doesn't cost you any money as such. Relatively 100 rupees or something for the course. It's an online course which is for 2 or 4 hours. It is available for your life. You can educate yourself and your relatives on kidneys, and it's been done very, very well. It is a very interactive course. So that's all I want to say.
Sounds nice.
Thank you very much, Professor Dr. Sunil Shroff, for giving your views. Thank you very much for giving the time. Now, I would like to invite my next panelist guest, and he's Dr. Prashant Marla. Dr. Prashant Marla is MBBS, MS, General Surgery, MCH, Urology. Is the medical director of AJ Hospital and Research Center. He is professor and head of the Department Urology, Andrology, Renal Transplantation and Robotic Surgery of AJ Institute of Medical Sciences. He performed first live related and brain dead renal transplantation in Dakshin, Canada. Welcome, Dr. Prashant Marla on our show. Dr. Marla, you have heard what Professor Vasudevan as well as what Professor Shroff has mentioned. Now, we would like to know from you, but before that, can you just turn your mobile in a horizontal position? Yes, please.
Is that okay?
Yes, fine. So, Dr. Prashant Marla, and we know that you are the pioneer, and I happened to meet you several times in some seminars before the COVID, definitely. And we found that the way you are doing and the way you are promoting, even in this year, I think only 2 organ donation took place in this up to February, and the AJ Hospital name is always there in the forefront. So we would like to know your views about the World Kidney Day. Dr. Prashant Marla, please.
Thank you, Mr. Goel. My inspiration came from Dr. Sunil Shroff, actually, and I think he has covered most of the things. I have learned a lot of things from him. Under his guidance, I started the awareness programs in Dakshin Kannada district. So thank you very much, sir, for your constant support for me. And I think my senior, Sir Vasudevan sir, also has spoken much about the organ donations. And in Mangalore, I think we are far behind in terms of the organ donation which is happening. Mr. Goel is also supporting us in a lot of endeavors. And ever since we started the awareness program with the Dr. Shroff here in Mangalore, way back, I think about 10 to 12 years back, it didn't yield any fruits till recently. We have been going around giving talks to people. Then finally, one day, about 6 to 8 years back, one of my staff's brother passed away. So she came forward and she said to do organ donation. So subsequently, we had a couple of organ donations, but Shroff sir always says, okay, keep doing things, things will improve. So I was, a little heartbroken where the support from other places were not there in Dakshin Kannada. So only one or two hospitals were supporting for organ donation. And now slowly it is picking up, and hopefully in days to come, we will have more organ donations in this region. As you rightly said, we need a helpline. We in Karnataka, we have a team called Jeevan Sarthakate, uh, and government body. There are people who are sitting in the government Venlock hospitals for, the counselors for organ donation. For any such donation, if someone is doing in any other hospital, they can contact the government hospital for the help, and they would, lead the donation later on. This awareness program, we can't say that we are celebrating World Kidney Day. It is a awareness program day for how to take care of kidneys. So that has to be done because, this is one disease which I feel, patient does not die, but at the same time, is all his resources, all his income which he has earned all this while, he has to sell to maintain himself. So transplantation is the best option for them because in terms of economics, but the lack of organs and lack of facility for transplantation is that has led to the less number of transplants happening in this country. We need more centers, more doctors doing transplantation. More than that, as Shroff sir told us, that awareness has to come from within our fraternity, medical fraternity. There are a lot of people who doesn't support. Basically, the first people who come across these brain dead people are the neurosurgeons and intensive care specialists. So if they motivate people regarding the organ donation, much more organ donations can happen. But the our own fraternity does not support, or they don't know about organ donation. Probably like we need to create more awareness programs. As sir said, we need to have green corridors among our own people in the hospitals, and things would look better. And the centers which don't have organ donations and or retrieval permissions or transplant permissions, they can shift to a nearest hospital where a retrieval can happen. We, as you know, we are trying for a retrieval center in our government hospital, which we haven't succeeded yet. So, but if all other hospitals support in the region, and the primary doctors who come across these people, like emergency care physicians, intensivists, or neurologists, we can see much more donations. And mm, we need to create awareness. People, unless people know about, as you said, some of the people will be registered as a donor, but the family members won't be knowing about it. So the entire family, we always suggest that the family should know about the donation. They have to sign on the paper, and they should carry a sticker on their vehicle or a card in their pocket saying that they are an organ donor. So these are all the awareness things which we need to do in the days to come to increase the number of donations. Thank you, sir.
Okay, thank you very much, Professor Dr. Prashant Marla. What Professor Marla said, very rightly said, that the conditions and the government hospitals are bad. I still remember there was a meeting held by the then say CMO, the Chief Medical Officer or the Director of Venlock, where he was also present and I was also present. And Dr. Prashant Marla emphasized that the retrieval center should be there in the government hospital. As Dr. Shroff mentioned, that the maximum number of patients of the road accidents are reaching to the government hospital, not to the private hospital. And if they will not have a retrieval center, they declare it as a brain death and nobody is taking care. So that's why the wastage of the organs are taking place at that point. And it is, if they, at least they will start retrieval center, even if they are not planning to start the transplant center, they can retrieve and send to others. In Dakshin Kannada, we are lucky to have 9 medical hospitals who are approved for the organ transplants. While I will give the, although Dr. Marla was saying that we are lacking behind, I will give you a figure of 2016 because afterwards, no figures, official figures have come from other states. In Dakshin Kannada or Mangalore district, we have 7 organ transplant in that year. While in UP, the entire UP, it was 7 in the entire UP. UP is 4 times bigger state than Karnataka. Forget about a city called Mangalore. Mangalore is a very small city, even a smaller city than the Mathura of UP. So one can imagine the awareness. Still, we have lots of awareness in South, which is lacking in North India. And North India, we know that it is not easy to convince the people, and it's a really hard task. And for that, first of all, I would like to thank Professor Dr. Prashant Marla for giving his views. I will be coming in the next round when I will ask some questions to you. Now I'm going to the north side, because we have taken 3 from the south side. Now the north, which is the most toughest battle, especially for the organ donation. And so I would like to invite and introduce our next panelist. She is Miss Sunaina Singh. Miss Sunaina Singh is the CEO of Organ India. She co-founded Organ, that is Organ Receiving and Giving Awareness Network India, as an initiative of the NGO Parashar Foundation in 2013. She represents Organ India at various platforms. Under her leadership, Organ India and has been twice felicitated by National Organ and Tissue Transplant Organization (NOTO) and Ministry of Health and Family Welfare. She is responsible for strategic planning in the organizations, guiding the team and providing leadership in all projects. A mother of 2, she is a former journalist and has worked as at News Track, Aaj Tak and News Laundry. Her dedication and persistence to the cause has brought Organ India to the forefront. Welcome, Ms. Sunaina Singh on our show. Ms. Sunaina Singh,
Thank you.
You have heard the 3 eminent doctors who are leaders in their field, but they all are from South, and they have given their views of what they feel about the medical facilities and whatnot. You being non-medical like me, and you are running in North India, although Delhi based, but it is covering the NCR and other places like UP and Haryana and Punjab and everything. And you know, the conditions there is not that easy, except Punjab, Chandigarh and Delhi, or the NCR, you can say, but other places. And still you are trying hard. And I know, because as I mentioned earlier, that you are the first whom I learned about the organ donation at Mathura when we have organized the first program and when you were invited as a guest speaker. You are forefront. You are training even the students, as Professor Prashant Marla says, or even Professor Shroff says, that the medical doctors are not aware. I have gone and I have spoken twice at Yonupaya Medical College here in Mangalore. And yes, it's fact, very few, except that, see, the transplant surgeon knows about the transplant of organs. The surgeons knows. But what are the formalities as far as the organ donation is concerned? They are not aware. And that is why the lack of knowledge they try to avoid. And that's why we are missing many of potential organ donors. And that's why so many pathetic deaths which are occurring every year in India. We would like to know your views on World Kidney Day. Miss Sunaina Singh, please.
Thank you so much, Mr. Goel. I almost called you doctor. So yes, you are right. In the north, it has been a very tough battle. When we started in 2013, I remember we went to organize a talk at a very big company, very big, with over 2-3 thousand people in that building. And our talk was at 4 o'clock, and we set up everything, and we waited there, and 4 o'clock went by and not even one person showed up for the talk, not one. Okay, in a huge company. So I called the MD whom I knew, and then after 15 minutes, few people walked in, almost as if they had been forced to go to the talk. I don't know what they thought, that we were going to take their organs and go, or nobody knows about organ donation, and it's a topic that's, when you think of organ donation, at least for our generation, it's about organ trafficking. It has very negative connotations, right? There are many movies which were made when I was small, and you would find, organ trafficking going on, trading going on, and all of that. So when we initially started, it was very, very difficult. And then we tied up with Mohan Foundation here in Delhi. We also had to learn the trade, which we learned from Mohan Foundation. So we're very, very thankful to Pallavi and her team here, and Dr. Shroff, of course. And over the next few years, things have been getting better. There is still some awareness happening in organ donation. Times of India does campaigns every year. NDTV did a NDTV More to Give campaign, which was a lot of it was in the north. So now people are a little more open to organ donation, because in the media it still comes, so and so donated and all. And now, thanks to social media, there is a lot more awareness on organ donation here in the north. However, it is still quite low. People are not really aware of it, or they don't know the details. And also, as Dr. Prashant and Dr. Shroff has said, regarding kidney, I mean, we have a helpline, like you said, we get almost 10, 15, sometimes 20 calls a day. Most of the calls are to do with kidney, right? A lot of people suffering from kidney, they are all on dialysis, they are all looking for transplants. And the other thing is that when they go to a hospital, many, many calls. So we have done a whole research on the helpline calls. So we take the year or a year and a half helpline calls, and we do a research on it, that what is it that is lacking in the public domain that people don't know about. And the main thing was that they were going to transplant centers. They were asking the hospitals, what should we do? And the hospital would immediately tell them, most of them, that aap donor leke aao, find a donor and come back, right? So they were not given the deceased donation option. They were not informed that maybe if not at this hospital, you can go to another city and put yourself on the wait list where you are likely to get an organ. They were not informed about ABO incompatible, which is another thing that Dr. Shroff was saying, that now you have ABO incompatible. But they were not informed. They said, no, we have a donor, but it's not the right match. So I said, there is something called ABO incompatible. They were not told about it. So I had to refer them to our blog on our website, where we have a couple of articles, and I referred them to some few hospitals. I said, look, all these people are doing ABO incompatible, and you can go there. They were not told about swap. Swap transplants, kidney transplants, there's another issue, because there's no national registry that you can, go. There are various people who have different registries. Hospitals, keep their own registries, but there's no national registry for that. So that's another thing. They said, okay, where should we go for the swap? And then I'm referring them to 3-4 organizations, but they are not all connected. So that becomes difficult. So I would agree that on the medical side, not only there is less awareness, but there's not maybe as much information given as should be given to anybody who comes. I mean, you have to tell them their options, right? They do have an option to swap. They do have an option of ABO incompatible, which maybe they would like to take. I know those transplants are much more expensive. But that is something for the patient to decide, not for the doctor to decide. So I find a lot of gap in the terms of the knowledge given to the patient and the family when they go to the hospital. Then they call up saying that, will we be okay after the transplant? So then we refer them to other people who've done transplants, or, we give them some material to read, all of that. And as far as medical fraternity is concerned, that is true. There is very little awareness, and not in the main hospital. I wouldn't say in Delhi or in in big cities, but definitely in the smaller cities. And like for example, we are now doing a whole uh, uh, awareness in Haryana, right? So we are now going to go to the civil hospitals in each district and do, sensitize the doctors there little by little and ensure that they become at least retrieval centers, if not transplant centers, that they have brain death committees and all of that. And again, it's difficult because there are no transplants happening in government hospitals over there. So that is something that one needs to start doing, whether it's any state. Government hospitals, there are very few who are doing transplants. And as regards the public is concerned, I agree with both Dr. Shroff and Dr. Prashant that yes, people are willing to donate. They will do it. Or if you counsel them in the right way, they will do it. But there is a lack of awareness. There are myths. People call us from the hospital saying that this is what the doctors are saying, but you're an NGO, so you tell us, is this a good thing? So that is something also that should happen in the north, that there should be an NGO presence in hospitals, which is really very much over here. And those government hospitals like Chandigarh and PGI, they're doing a fantastic job. They're the one place where they're amazing, lots of transplants. They have a great team set up. They counsel the patients. Everybody's on board. The neurosurgeons, the transplant specialists, everybody is fully involved in it. So they managed to do really well. But for the rest of the north, yes, I mean, I don't see much happening in UP, and but hopefully it will pick up now. One can't say that it won't pick up. And as far as the general public is concerned, they're very open. Students are very open. We have a great school program going on in Delhi. Students just love the idea. They're very interested. And once they know, then for the rest of their lives, they'll know, So unfortunately, because of COVID, that school program took a hit. But now we will restart it, especially in Haryana, in the rural areas and other districts.
Okay, thank you very much, Ms. Sunaina Singh, for giving your views. And she also agreed with what Professor Sunil Shroff as well as Professor Prashant says, that the awareness among the doctors are lacking, and they should be given more awareness. I still remember there was a call about last week or 2 weeks before from a hospital, very leading hospital in North. And they said that the one patient is brain dead and the relatives have all gone. They said, no, we are not going to take him now. You do whatsoever you want to do. Now they are the medical director called me here and he says, what to do, sir? So I said, okay, because it's a North. So I immediately contacted Miss Sunaina Singh, and then she would have done whatsoever. But this is the condition today, that the relatives who suppose they are saying, no, okay, you do whatsoever you want to do. If he's a brain death, you do. And they fled. They says, no, we are not, because they were worried about the payment, which is myth, because everybody knows that once an organ donor declared, then no question of money taken from them. But even the hospitals and the doctors were not aware of where to contact, what to do. So the person, because he was knowing me, he contacted me here and I have to contact. So this is the communication gap which is lacking in India. If we will be able to control that, then only things can happen very easily, which I have seen in United States. That they have a state transplant organizations where they control everything. Every death in that particular state is supposed to be informed within one hour to that particular thing, and then they take action. Thank you very much, Ms. Sunaina Singh. I will come back to you for the next round. Now, my question goes to Professor Vasudevan. Professor Vasudevan, are you there? Professor
I'm
Dr.
here.
Yeah.
Yeah, I'm here. Yeah.
Professor Vasudevan, you have heard Dr. Shroff has mentioned, Dr. Prashant Marla has mentioned, and even Ms. Sunaina Singh, and everyone is saying, apart from public, the main problem is that is the hospitals, the medical fraternity. Now you are a organ donor committee chairman of IMA. You are dealing with lakhs and lakhs of doctors. So what program you are planning in your IMA so that at least the medical fraternity can be trained? It is not easy for person like me or from person like Mrs. Nena Singh to tell the doctors about organ donation, because doctors are way ahead of us as far as the medical knowledge is concerned, but as far as the organ donor, but they feel
that if we are saying you are not a doctor, you are teaching us. So we would like to know whether IMA is having some such program to educate, especially the government hospital doctors, which are reluctant to listen. I mean, to declare I still remember Professor Marla will vouch. He was insisting that at least the government hospital doctors should declare a brain dead. Then we will see. We will can come and send our team for retrenchment also. But also that they are not taking any chance. What do you say about this, Professor Vasudevan?
Yeah, I will first say that it is this lack of this a positive attitude among this medical fraternity that led me to work in this area. Years back in 2014, when I was working in Kerala IMA, I understood that this positive attitude was very much lacking among our medical fraternity. So in every meeting of my branch IMA as well as in Kerala State IMA, I used to talk about this. I used to conduct several awareness programs among in our branch itself. That is the which all this we should understand that these organ transplantation programs have all been developing side by side, and for a average MBBS doctor, this does not form part of the curriculum, and these are higher specialized areas. So many of them would not have been familiar with these protocols and areas during their basic medical education. As they progress up into their specialities, they would come across this. So we need to bring this medical knowledge to our medical fraternity. We used to conduct several such programs in our IMA, and as I started working in Kerala IMA, I understood that our leaders quickly grasped the this awareness. We conducted several such programs in our state meeting. In one particular state meeting, I remember we had persuaded all our leaders attending the state program to sign organ donation consent forms. And that was a big news because our profession itself took the lead in showing an example in signing these forms. I should also acknowledge the help of my state leadership at that time, all of whom had very positive idea to this. And gradually I extended my work into the national area. And we should understand that as we just heard Ms. Sunaina Singh, so there are several states in the north as well as the northeast where this program is still not very active. There are several states in the eastern part as well as the northeast where a credible organ transplantation program is not yet there. So it is through our urologic society that we plan to uh, take up more states to have this program. For example, a big state like Bihar, it is recently that a good organ transplantation center has come up in Bihar. So we need to, as we said, we need to ensure that more of these colleges also come up with these programs. So this is a constant endeavor, and change will take time, but we are progressing in the right direction. And it is with this view also that we thought in national IMA we need to bring this up. And I should acknowledge the help which was given by our former national president, A.K. Agarwal sir. So though he was a physician and cardiologist, he was actually waiting for someone to take up this. And he immediately helped to form a national committee. And we now have a national standing committee for this program. And in addition to kidney, we are also thinking of these programs for cardiac, liver, and we have conducted several meetings in the national IMA where we could bring together stalwarts. For example, there is this Gangaram Hospital where Dr. Harsha Johri is there. He is part of our committee. Today he messaged me saying that They have completed 6,000 programs, cardiac kidney transplants total in their institution. So we also have this several other hospitals in Delhi, where, example, Dr. Anup Gupta is there in Safdarjung Hospital. He is also a stalwart. He is also conducting several such programs. So whenever we can bring up these people together who are doing work individually, whenever we can bring them together on a common platform, we see that the speed of awareness created will go double or multiple times. So that is the endeavor of this committee, to bring together stalwarts and also educate our leaders. And we have several, we are doing many of these programs in our all the branches across India. And national IMA has branches in every state, and in every state has got many branches. So if as we conduct more programs in every branch, we can surely get the cooperation of the medical community and bring them up. In addition, there are several organizations who also looked at these paramedicals. So we need to bring up the nursing profession too, because they have an opportunity. They talk to the patients, and they have opportunity to create awareness. I should also mention at this time a slogan which was coined, a simple slogan which was coined by Dr. K.K. Agarwal. He said, "Puchna mat bhulo." That was the statement he said. So whenever you have an opportunity to create a situation for organ donation, you should not hesitate to ask. So this is applicable both to the doctors as well as nurses, and also the transplant coordinators. Don't forget to ask them. If you ask them, surely they will consent. That is what Dr. Shroff also told us. So Puchna mat fulo, that is the apt message in this occasion. Thank you.
Thank you very much, Professor Vasudevan. Puchna mat bhulo was really a correct, very apt slogan by late Dr. K.K. Agarwal. Thank you very much. Now, my question goes to Professor Dr. Prashant Malla. Professor Malla, you have heard, and you also mentioned about the medical fraternity. Don't you think that this, at least especially for kidney thing or for transplants, it should be added in the curriculum in medical as well as for nursing and paramedics, so that, because as Professor Vasudevan rightly said, that the nurses are always with the patient, doctors are not that much, they can't spend that much time. So if nursing staff and the paramedics as well as the doctors are all aware, whether they are MBBS, whether they are of any specialty, but at least if they know about organ transplants, basic things, they can, organ donation, sorry, they can at least tell the family to contact to the coordinator or convince them. Because many times it happens that if I have a ENT problem, I am going to ENT doctor, or a cardiologist to cardiologist doctor. I don't know that my kidney is this thing, and if I require something, they can suggest that why not you do, if they have the preliminary knowledge about this. What do you say about this, Professor Malla?
Yeah, it should, knowledge transfer should be there even in the colleges, because not only in the medical schools. So you know, we have been doing all these rounds in the PU colleges and degree colleges as well. And in our medical school, we generally have these organ donation awareness programs. And it is, you know, we should add it like probably a small curriculum. It may not be like, you know, it can be added into a general surgery curriculum. It may be a one small chapter regarding this organ donation. But nevertheless, most of the medical schools are having some kind of awareness program or the other, which are doing for the doctors as well as nurses here. What I feel what we should do was, sometime back, we insisted that in Karnataka we should start a brain dead registry. If whatever the organ donation happens or not happens, but there has to be a brain registry, so that we know in a particular month or a year how many people are brain dead. So gradually, like if some hospital is registering more brain dead, so that we can approach them and ask them for a donation. And media plays an important role again. As Ms. Singh told earlier, media was projecting organ donation in a bad manner. the movies and all. Like I still remember when I was in Manipal Hospital, it was projected that the transplant surgeons are like thieves, taking away the kidneys. So the movies and TV shows should give a good message regarding the organ donation as well. So we should encourage more such movies or some awareness ads to come into the media. That's what I feel.
Professor Malla, what you said, I fully agree, and I still remember you have produced one movie, a small movie on the organ transplant, organ donation, and you invited me as a chief guest, and we had a program. But the problem which I can see is how to promote that movie. That is what I asked the other day, and to in one of my program, to even Dr. Vasudevan and one Rotary Club. He's the district Rotary organ donor, organ donation coordinator. And they says, okay, you send to us, we will do it. But it is, why not these types of movie to be promoted free of charge, and it should be shown, because it's a small movies of few minutes, or not even half an hour or so, or whatsoever time. It should be shown on the Doordarshan at least. So awareness is something which is a real charity social work which you are doing. But that is the main reason that we are not getting that support. And you rightly said, and Ms. Singh also said, the media has to be positive. They always try to come out that so and so religion is against this thing, and they will give some news from somewhere, and they will hype that thing, which is unfortunate. Thank you very much, Professor Malla, for giving your views. Yes, Dr. Vasudevan, you want to say something? You have raised your hand, Professor Vasudevan. Yeah, yes.
Yeah. Actually, the one point which I mentioned is, in IMA we have also a program whereby we have been getting our medical students into this area. So we have a medical students network called MSN, as well as a young doctors network. So both these organizations have several programs to bring the awareness of our younger generation. That is, the next generation is already being made aware of this. I said earlier, these update programs are needed for the already practicing people. So we are bringing our medical students already into this. Another point which I just as a follow-up to Professor Malda. So his view, in Kerala also we have done a movie, a short feature film, which is about 45 minutes long, which was done by one of our organ donors. He had done earlier a donation for his sister, and later he produced this movie it was his first venture. He directed this movie of 45 minutes, and our health administration, especially the health minister at that time, she had seen this and appreciated it. But as you said, there is a lack of avenue of publicity, of giving publicity to this. We could not get a theater release for this, and still we are hoping to get our national IMA into this so that we could promote this.
Yes,
and also there is
yes, please.
We have also another director, a film director, who conducts regular.
I think we lost you, Professor Vasudevan, but you have made a very clear point. But I know that Professor Malla spent his own money from his pocket to book the theater and refreshments, etc., but without any gain. Professor Vasudevan, we have lost your connection.
These avenues to get this into the public.
Okay. Yeah. Thank you very much, Professor Vasudevan. Now my question goes to Ms. Sunaina Singh. Ms. Sunaina Singh, you have mentioned about media, or until unless the interest is to be created in the general public. Like I went to New Jersey about 3 years back, before the COVID, and the last year they were supposed to organize the World Transplant Games in 2020, but because of the COVID,
2021, in Houston.
No, that was in Houston. New Jersey was on 2020, and they invited me as a guest, but because of COVID I could not go. It was in July. So, but you are the one of the representative, I must say, of or the team manager for the next World Transplant Games, which is going to take place in Perth 2023.
Correct.
We would like to know about that also, but why not we also do something interesting in India? So the public, they say that what they are doing, I asked this question to them, why you are doing this transplant? Well, the advantage is it not only give the encouragement to those who have donated their organs, but also create a very good public image and public awareness about the organ transplant. So my my question to you is, first you explain what you are going to do in this World Transplant Games, which you are the member organization from India side, as well as why not we do such type of activity in India? What you say
Okay.
about this?
Yeah. So firstly, we do these activities in India. There is a federation called Narmada Kidney Foundation, and they hold what is called the National Transplant Games. They used to hold it obviously every year, but in the last 2-3 years, it's not been held. Also in PGI Chandigarh, every year or every second year, they do have games as well. So it is there. The thing with the World Transplant Games is that it is held every 2 years by the World Transplant Games Federation, which was established in 1978, and it's recognized by the International Olympic Committee. So it's a worldwide organization. It has representatives from more than 60, representation from 60 countries, more than that. And the principal aim of the World Transplant Games is to raise public awareness of the importance and benefits of organ donation and transplant by demonstrating that health and fitness can be achieved post-transplant, right? So you are, at the same time, you're having these games and you're giving an opportunity to the recipients and the living donors to come out and participate at a very good level. And the participation and the kind of level of sport is very, very high here. It's not that it's low and, oh, they just transplant patients. These patients have really worked hard and they played really well. So they not only want to do it for patients and living donors, they also want to do it for the public. So the public gets aware that, oh, there's organ donation, there's transplant, life is good after a transplant. And it also provides transplant recipients and living donors a chance to represent their country, right, at a sporting event, and competing at a high level against their peers. So basically, it's the Olympic Games for transplant patients. So India has participated 4 times before, and a total of 19 athletes in the previous 4 times have gone. In the last games in 2019 in Newcastle, the team was led by Light Alive Reena Raju Foundation, and she took 14 players from India, and we won 7 medals. We won 4 golds and 3 silver, and we won silver in badminton. We won silver in squash. Very, very highly competitive games. And these are patients who've had, one of them both of them had kidney transplants, and they were playing at a very high level. But then they went through their whole transplant journey, but still they can totally fit and represented India. And if you see them, you think like, wow, they're such good athletes. So this time for the transplant games in 2023, which are going to be in Perth, Australia, Organ India, we are an initiative of Parashar Foundation. So Parashar Foundation and Organ India have become the member organization from India for the World Transplant Games. So we will be taking a team of, so far we've already sent out links and all to see how many people are interested. And so far almost 70 people have, signed up to go, many more than last time. Eventually, I suppose 40-45 minimum will go. It'll go a long way in raising awareness. It'll create media interest. It'll create public interest because they are representing.
Miss Singh, just tell me one thing. Who is going to bear the cost for the players?
The bearing of the cost is for athletes. The athletes have to bear their own cost. We will bear the team management costs, obviously. We will be asking various hospitals, doctors, general public to give some funds towards each athlete. Some of these athletes are amazing, but they just it's very expensive, and athletes have already, they've already spent so much money on their transplant and the post-transplant care that they don't have the money to go. So some people do, but mostly they don't. So we will be I will be sending you also a deck. I'll send Dr. Prashant and Dr. Vasudevan as well. And we would like the entire medical fraternity, to also pitch in and help these athletes to get where they are going.
That's
So,
why I asked,
yeah.
because IMA or such type of organization should ask the government, and they can also fund something, because after all, as you rightly said, so much expenses they have done. And
Yeah.
in spite, if you want that they should bear, after all, they are going as a national representative. They
Correct.
must. Now, my question goes to Professor Vasudevan. Are you there, Professor Vasudevan? Dr. Vasudevan, are you there? No, I think he's not there.
Yes,
Professor,
yes,
okay, Professor,
yes, yeah, yeah,
one suggestion, if you want to give last, one suggestion to the government,
yeah,
what will be
yeah.
your suggestion for the kid on this kidney day?
The actually it is difficult to limit to a single. We already have our highest leader speaking about this several times in his address. Our PM has already talked about this increasing transplantation as well as kidney care in several Mann Ki Baat programs. So that is the importance that this government is undertaking. We should give more importance. Actually, the NATO should take up more, what they call, should be more thorough in their work, and so that we are able to bring up this infrastructure also, or this conducting transplantation programs in several institutions. Side by side, we should see that these preventive programs are also taken up in big in a thorough implementation. I think that's the message I have to give.
Okay, thank you very much, Professor Vasudevan. Professor Prashant Malla, what message you would like to give to the government? If you have to give some suggestion, one suggestion, what suggestion you would like to give? Please unmute. Please unmute.
Sorry. Government has a budget for media and publicity. They have their own hoardings. They have media space in the theaters where they're promoting anti-tobacco and personal hygiene videos and all they're putting. So similarly, they should have some awareness programs in the theaters. They should have awareness programs in the Doordarshan or any other channels, so that it is constantly coming into the view in the public, so that people will know about organ donation. At the same time, they should increase the number of centers, and people who declare the brain dead has to increase, and the whole process they should make it little more simple.
Okay, thank you, Professor Dr. Prashant Malla. Now, Ms. Sunaina Singh, what suggestion you would like to give to the government?
I think they have all systems in place, so they really need to, empower the system more and make sure that, NATO has the funding and the staff and everybody to take forward the situation. And I agree with Dr. Prashant; they do have money for media spending, and it should be totally geared toward. At least this program should be totally geared, and at least in the government can do a lot of things, by passing simple, they should recognize all the NGOs. They should make sure NGOs get because there are many NGOs in different parts of the country who are working, right? And they should, take them on board, run the program through them as well. It does happen, of course, but not in a very organized manner. So that's what should be done as well. It's a huge country, like Dr. Shroff has said. There are many, many people, many helplines are required, many NGOs are required, a lot of boots on the ground. And I think if those people like NGOs like us get help from the government, we can, on behalf of the government, take that program forward. We already work under the aegis of NATO, and most of the NGOs do.
Okay, thank you very much, Mr. Nancy. So, viewers, we have seen today all the experts in this field about the kidney. They have spoken thoroughly about this, and they are saying very clearly the awareness is required. Who is responsible? Why we look only towards the government? So many NGOs are working, but the responsibility lies with the civil society, we ourselves. If we are not careful, how we expect the others are going to save the lives of our own children? We have to see that today the kidney, the way it is, disease is going, increasing day by day. tomorrow anyone of our own children will be suffering, own relatives will be suffering. So please try to understand how to prevent the kidney diseases. Secondly, whenever about the organ donation, about the kidney donation, because this is a donation which any living person can give to their own family members. You are saving your own family member. You are not saving others. At least try to donate it. And when there is a swap provision is also available now in India, you can avail that. But don't blame the doctors every time. Anytime if a brain dead is declared, try to understand the doctor is telling you the fact. And there is a committee. There are so many checks and balances government has made. No one can do any hanky-panky in this. So please keep faith. Try to see to it that no one should suffer, at least with this deadly disease, which is in our hand. We are not God, but God has given us power to save the lives of our own, if not brain death, even during our life. Thank you very much. Today's program has been live telecasted by V4 News, Karu News, V4 Stream, Malnadu TV India, News Gaon se, Samvad Sarokar News, Bharat Post News, Gyan, as well as shown live on Facebook and YouTube. And our endeavor to bring to you every day new topic in media conference with Lal Goel at 10:30 a.m. And tomorrow is a Friday. So tomorrow is our Youth Conclave Day. So Youth Conclave, our topic on Gyan Ki Pathshala is Youth Conclave on Business Valuation. And we are going to have 12 Pan-India youth students from MBA, BBA and MBA participating from different parts of India. And our chief guest to give the replies to their all queries is going to be Professor Dr. Sudhir Saran, former visiting professor, IIM Lucknow and University of Texas at Dallas, founder Dr. Saran Consulting, California, USA. So please tune in tomorrow for media conference with Lal Goel at 10:30 a.m. Thank you very much, Professor Dr. S. Vasudevan. Thank you very much, Professor Dr. Sunil Shroff. Thank you very much, Professor Dr. Prashant Malla. And thank you very much, Singh, for joining, giving so much time to us to give the awareness. And thank you all the viewers. And viewers, you can understand these professors have so much busy, but they have given time just to create awareness. So please try to avail the benefits, try to enlighten yourself. And once you are enlightened, the day is not far, then we can proudly say that India is also a wish guru, even in the CKD or the kidney disease.